Sonu Goyal's
video presenter and innovator, and SRIHR Chennai for ophthalmic. Am I clear now? Am I audible?
yeah.
So John, am I audible now? So
Yes.
next presenter in line is Dr. John Davis, a glaucoma consultant from the West End Eye Hospital, Cochin. He'll be talking on iGrader, smartphone app for ophthalmic clinical grading. All to you, John.
Thank you, sir. So
You
this
can
is
start sharing your screen. Yeah.
I'll start, miss. So this is an app which
No, John, I think there is some problem with your internet now. There's a lag in your voice.
Is my screen visible?
Now it's okay. Now it's okay. Yes,
Yeah,
now it's
yeah,
visible.
yeah.
Okay. Yeah, so this is iGrader. It's a smartphone app for ophthalmic clinical grading made by myself. And I am Dr. John Davis Akkara, and I'm at Western Eye Hospital, Cochin. And now I'm working as a senior resident in Sri Ramachandra Medical College, Chennai. And so first, let's talk about the importance of clinical gradings.
You're not presenting.
Grading scales help to objectively document clinical findings. And there are several good clinical grading scales, but it is not feasible to memorize all of them. It would be convenient to have them at your fingertips. So this was the problem. And noting the absence of any existing app, we, the authors, we programmed a smartphone app with all the necessary grading system inside. So that is this app. So why should we do clinical grading routinely? Clinical grades and scales, they help in standardization of documentation, which is very important. Objective documentation of the most of these grading scales are numeric grades and have 4 or 5 steps of severity. So they all look the same. And qualitative and quantitative grading systems can be improved with finer scaling to enhance the ability to detect smaller degrees of changes. So it's the conclusion of a study done by, I think, a Japanese group. So we can have all these if we have these at our fingertips. So often these are ignored or approximate measures are used, or sometimes they are misremembered and wrongly interpreted. So this is a very common problem. It leads to confusion in documentation, and valuable clinical information is lost, especially when communicating between multiple clinicians. So we decided to make this app to provide an offline searchable database of clinical grading scales in your phone. So it can be readily accessed by anybody in the ophthalmic field. So how was it made? So I do a little bit of programming myself. So I got the help of my postgraduate students, and we collected, while they were preparing for exams, I told them to just make a list of all the grading scales which they were studying. I put them together and used an app building software called Phone Gap. And using that, I was able to put all these grading systems into a searchable list. And this was converted into an app and put into the Google Play Store. The iPhone version was not made just because of the higher cost, but it is ready to go if the App Store regulations are met. As of October 2020, we had around 3,000 downloads from around 80 countries, with the maximum users being from India, USA, Mexico, Egypt, and Jordan. And you can send any suggestions to myself at iDoctorEngineer or John Davis Akkara, and I will update the list of grading systems. So this is just my about the software and apps which I made. This is the video.
iGrader smartphone app made by Dr. John Davis Akkara with the help of Dr. Anju Kuriakose. The authors have no financial interest in this presentation. The app is available free for Android. Open the Google Play Store and search for iGrader. You will see iDoctor Dr. John's app iGrader. Click it, install it, and then open it. It will load with a splash screen, and you will see the various sections: cataract, glaucoma, retina, cornea, oculoplasty, neuro-ophthalmology, squint, and others. Below that you will see a search box and the list of all the gradings in the app. Click the search box and a keyboard pops up so that you can type and search for a particular grading. In this case we have two grading systems with the same name. Let us open the SHI system of gonioscopy. This takes us to the SHI system of grading with the table and the diagrams corresponding to that. Now let us look at the cataract gradings. Let us open the grading of cataract and let's look at some glaucoma gradings, gonioscopy, optic disc, the Moorfield's Bleb grading. Even here the pictures for the individual gradings are there. The disc damage likelihood scale, the Van Herricks grading, the retina gradings of diabetic retinopathy, hypertensive retinopathy, and others. So this is the gas classification of macular hole and the other gradings such as the cells and flare grading. Let us also search for, say, diabetic retinopathy. There is a comparison of the various diabetic retinopathy classifications in this table. If you scroll, you can look at all the grading systems available in the app, and you can go and open any one of those. So that is all. Thank you very much.
Thank you, John.
Thank you, John. I just had one question, Sonu, before. Is there any financial interest in this, John?
This was made by myself, and it is offered free, so there is no financial interest. I programmed it myself. I made a App Store account for $25,